So why don't you explain to us what really bothers you?
Well, quite a while back, I lost quite a bit of weight, probably
Yeah.
65, 75 pounds, 65 now, 75 then. And I have craggy skin. It drives me crazy.
Yeah.
I won't wear a turtleneck when I ski. It actually drives me crazy.
Yeah.
I think it's just awful. Every time I look in the mirror, that's all I see.
Yeah.
So.
Yeah, and I agree with you. If you actually look at your face, you have pretty good cheek definition, which a lot of people lose up in this area, you know, when they get into their 50s. But really, your main problem is down here. You can see here with her, you had this excess skin right here, which is not bad, but I think you and I both agree it's something that needs to be addressed.
Mm-hmm.
You can see in terms of here, and we'll do this one more time again from the side of the chair, but you can see from here that her chin is less defined, and then she has a lot of this skin here and some fat underneath. So what we're going to do is liposuction this entire area and get more definition, bring this up like this, as you can see here. Furthermore, we're going to address the mid-face a little bit today. We're going to address the neck, and that means doing an incision around the ear and coming up into the hairline. We'll talk about that further after I mark you. All right, we're going to do our markings for the procedure we talked about before. We're doing the neck lift right through here. And that means we have to really get this kind of pull here for the neck. Also, we're doing a little bit of like a mini face right through here. Her cheek definition is great, so there's not too much we need to do up there. The incision is going to kind of be in the hairline here, just like that. It's going to come up here on top of the ear, come out through here, and end about right there. So you can see that. You would never see that, even when you wear your hair back, but most of the time you wear your hair down, so you wouldn't see it anyways. Then we're going to bring this incision down here in front of the ear. This part of the ear is called the helix, so we're going to bring it in front of there. Right in that little crease. We're trying to give you a little bit of sunlight here to see where that crease is. You can see the natural shading in there. So we're going to come down through here. And then we're going to go behind the ear, behind the tragus, behind this area. I'm not going to make those marks now, make those later on, but you get the idea. So the scar or the incisions actually go inside the ear. So when you're looking at your profile or even in front, you wouldn't see that scar. A lot of times in the old days, we would put it around the front, and that would leave different color skin from here compared to there. The only time I actually do the front incision is sometimes on men who have a lot of beard. Next, we're going to bring this out. It's going to come back out through here. Come down here. You have nice little petite earlobes. A lot of times with age, the earlobes are large, and I can reduce those at this time of the at the time of surgery. But your ears look great. So then we're going to come out behind the ear, and the incision is going to come up in this area. I'm going to make some markings, not a lot, but just so you get an idea. Right there, and then right up in this area. Good. And turn back toward me. And then we're going to have to come back into here to the hairline back here, or the occipital hairline. I usually make that component of the incision above the tragus, so it's going to come out like this. All right, let's do that real quick. There you go. You can see there. So only this top part would show with your hair pulled back in a tight bun. I mean, how often do you wear your hair like that?
Never.
Yeah.
My husband told me this morning never to do it.
Yeah, I know. And then this is going to come down here a little bit, like this, and then go into the hairline here, way up in the hair there. Just going to mark this a little bit more so you can see with the camera. And that's it. Okay, Julie. This is our post-operative interview. We are about 4 weeks out from your surgery.
Mm-hmm.
What we did was a face and neck lift. We did something a little bit different. We did it in the office. With you awake, you had a pill to make you relax, but you were awake. And we used some local anesthetics to numb up the areas that we were treating. Quickly, we'll go through the process of what it was like to do the procedure in the office, to do it with you kind of awake. We did a little local anesthesia and some pills to make you relax. Why don't you kind of explain that experience?
Well, when I came into the operating room, I'd taken a pill, and then you did some injections in the local different areas, and I was kind of, it was kind of like a kind of dreamy you're actually awake. I could hear you speaking to the other doctor and everything else, but I couldn't really, I didn't understand everything you were saying, but I was absolutely alert. I didn't feel anything. I felt you like pulling places and different things like that, but nothing, no pain of any sort. It wasn't painful.
Which is pretty amazing because it was 3.5 hour surgery. And you were basically awake the whole time, even though you were relaxed and maybe kind of sleepy. We did the numbing medication in all the areas, and that's what's pretty amazing. I think that that's what's changed the paradigm of some of these procedures. In the old days, we'd always do everything in the operating room, everything with general anesthesia or a tube in your throat, and now you can push the limits a little bit and do some of these things in the office. So how do you feel about your results?
I am golden.
Yeah.
I am so happy. I really am. I'm beaming. I'm happy.
Yeah.
I'm so happy. I mean, it feels, it actually feels taut, like I feel, it makes you feel younger even that it's taut.
Yeah.
It just feels like it's nice and snug, and all my wrinkles are gone from underneath my neck. I mean, even this is pulled back. It's just my whole face feels younger, refreshed.
Mm-hmm. Do you feel like you look like yourself?
Yeah, I absolutely look like, and we're talking about, when you see bad,
Yeah.
bad facelifts or bad whatever lifts, and you go, ooh, scary. No,
Yeah.
because my eyes and everything, my whole face is absolutely the same. To me, it just looks like it's better.
Yeah.
I mean, I don't think many people see me haven't said a thing.
Right, and that's where it's so funny because I have a lot of patients that see me. And, that's one of my expertise, more of a natural facelift.
Mm-hmm.
People seek me out for that, and it's so funny because the people seek me out, and then afterwards, they're so happy, but they want so much to share it with other people. But the people see them, they're like, "Wow, you look good," but they don't know what's going on. And in a way, it's not like they're disappointed, but they almost want for the person to say, "Wow, you have an amazing facelift." And I told them, and I reinforced to them that like a really good facelift is something that people don't know. Is that when you walk out, when you look in the mirror, and like yourself, you have this feeling like, "Wow, I feel good today.
Mm-hmm.
I can walk outside and kind of keep my head up high." No pun intended.
When I looked in the mirror, my eyes don't bother me, things don't bother me, my neck, it bothered me. It
Mm-hmm.
made me feel like I was older than I thought I should be. Because
Right.
I take care of myself, I exercise, I eat right, I do all those things. It really bothered me. It
Right.
made me unhappy.
And I think that's important to note that, how old are you, if you don't
I'm
mind me?
56.
So you're 56, but you're an active 56. You're healthy. You were more on the natural side. You didn't.
No.
Your number one priority wasn't like how good you looked when you walked out in the morning, but even in someone like you, who's more natural, who's more focusing on the exercise and the nutrition, which are very important from my standpoint, that certain things were really bothering you. And the conversation that you and I had beforehand was, you look great, but those areas that really bother you, there's nothing we can do besides surgery. And that's the kind of trap that people get in because they go into certain offices and not that the doctors are unethical, but they'll have all these different treatments, and then they'll tell them, "Oh, we can tighten this and do that." And the honest truth is, with the way technology is these days, it doesn't work. And I told you that. I said, "Look," I said, "Julie, basically, I can do something for this. It takes me about 3.5 hours. Is that worth it to you?" And I know that you thought about that because it was something, but you had already almost made up your mind before you came in the office.
Because that's what really bothered me. And the thing is, I think you do it for yourself. I mean, when you do something like this, hopefully you're not doing it for others, but you're doing it for yourself.
Right.
And that's what I was doing it for.
Right.
The swelling, it's 4 weeks today, and and the swelling is almost 100% down. I think it looks absolutely fantastic. My skin looks fantastic. My neck, my husband said he's bringing out the new model, because I'm 56 years old, but
Yeah.
I had all the crinkles and craggles, and I don't have those
Yeah.
anymore, and I just feel great. I look rejuvenated,
Yeah.
is what I think. I really think I do. I mean, I think, my girlfriend saw me probably, I didn't see her for 2 weeks, and she's like, "Oh my gosh, I'm so jealous." She goes, your face, we're the same age, and she goes, "Your face just looks so rested." It looks rested.
Right.
It's just, I'm thrilled.
Yeah.
I'm really thrilled.